Hi there everyone, this is Adrien, the exercise specialist from the Leduc, Beaumont, Devon Primary Care Network. I hope you're all doing well today. Today's video I thought would be a little different and a good kind of example of a scenario that a lot of people end up going through a life of being physically active. And that's injury protocols and how to how to rehab an injury and what that tends to look like. I know I've posted some similar videos in the past talking about things like the peace and love acronym as opposed to the RICE acronym and things like that. Please watch that video. It's an awesome video, and I'm going to kind of explain an example of when that could be helpful. An example of how to use it, and also some differences when you can deviate from that principle and go a little more towards the RICE, even though that's a little bit kind of out of common practice now. This video will be a little bit education, slightly sciencey heavy, not totally. Let's be mentioning certain specific muscles and the protocols. This kind of a protocol is what certain people tend to use in terms of exercise specifics and things like that. These aren't necessarily what everyone uses, but this kind of a scheme tends to work well for a lot of people, including myself. So for this scenario, I'm actually going to be talking about, as Coach Luna comes to join me, I'm actually going to be talking about a specific example that actually I'm currently experiencing as I am currently recovering from an injury. So what I'm actually currently recovering from right now is called pes anserine bursitis. So what is pes anserine bursitis, as Coach Luna wants me to show her? So pes anserine bursitis. It's okay, Luna, I gotta do this. So, pes anserine bursitis, what is that? So, it's a form of bursitis in a certain area of your body called the pes anserine. So, you have these things that are called bursal sacs in your knee. You have bursal sacs all over your body, actually, to be fair, but you have four main ones in your knee. And your pes anserine is a specific one that is just distal, so below your kneecap, and medial, so just on the inside. So it's just below and inside of your kneecap, right in there. And so, how did I determine that that's what I was experiencing? Actually, before we get to that, let's talk about what a bursal sac is and what bursitis is. So a bursal sac is like, it's what it sounds like. It's a sac of fluidy kind of a tissue that kind of protects. It kind of protects your actual muscle tendons from rubbing against the bones in certain areas. So it helps protect. So it gives them a good surface to slide on. But they can get aggravated, and when they get aggravated, they swell up, and that's when bursitis happens, and it can be very painful. Often takes quite a while to recover. It can get re-aggravated very quickly, and you're back at stage 1, so on and so forth. So it's a pretty it can be a bit of a hassle. You can get them at all the bursal areas of the body. Common treatments are obviously just regular rehab that I'm going to talk about. Certain people I've heard of getting cortisone shots in the bursal sacs, or having the bursal sacs actually removed in a rare scenario, but those are definitely, like I said, far less often. So how did I know that I developed this specific form of bursitis and the actual area it is? Because oftentimes it's kind of difficult to tell if you have just a regular knee injury like an MCL injury, or even a chip to like my tibia bone or a meniscus or something like that. So how did I determine that this is what I had? Because pes anserine bursitis is a very specific thing, and it's not a hugely rare thing. It's not a rare thing, but it's that specific bursal sac isn't an often factor that's injured how I did. Most people that actually get that develop it from long distance running and things like that, which is not how I got it. The pes anserine, that actual bursal sac there, it helps protect kind of 3 attachment points for 3 specific muscles in the body, and those muscles are your semitendinosus, your gracilis, and your semitendinosus, your gracilis, and your sartorius. So what are those muscles? Your semitendinosus is one of your hamstring muscles, so the muscles on the back of your leg here. It's the most inside muscle. If you actually go up behind your knee and you feel like a little kind of wiry thing sticking out here, that's actually the semitendinosus right there, because it is primarily tendon. So you have 3 hamstring muscles, and that inside one is your semitendinosus. So there's that one. Then you have your gracilis, which is a muscle on the inside of your leg here. It's one of your adductor muscles. So it's inside here. And then you have your sartorius, which your sartorius actually starts on the inside of your knee, and it comes up, actually wraps along the outside of your leg. And it goes kind of like that. Fun fact, sartorius, the word sartorius actually comes from, I believe, the Latin word for tailor. And the reason why it's the Latin word for tailor is like a suit tailor, because what the muscle does is it does this motion for you, where we put your leg up. So it's doing this motion, right? And so, you know, when the word came out, tailors were often sitting like this, working on clothes and things like that. Hence why they gave that muscle that name. So, semitendinosus, gracilis, and sartorius. So how did I determine that that's what I had? I did all my different little, you know, personal manual muscle tests and things, and I noticed that when I would get the pain, which would be in this area right here, where the attachment point is, it was only when I was activating 2 of those 3 specific muscles actually. So my gracilis actually wasn't an issue, thankfully, but anytime I did hamstring activation and sartorius activation, I was getting a lot of significant pain in that area there. Which let me know that that was the area of the issue, because those 3 muscles all attach right there, and that's what that bursal sac actually protects. So that's how I figured that out. The hamstring, so the semitendinosus was by far the worst of the 3, by far worse. Anytime I pretty much contracted my hamstrings, anytime I brought my heel inwards at all, I would get like a 6-7 out of 10 pain. It was very not pleasant. Or anytime I would go like this, I'd get about a 5 out of 10 pain. So something like standing up, putting my shoes on, was impossible. Couldn't do it. But gracilis movements, no issue. So that's how I figured out kind of what I had. Obviously, you want to go to you know, a professional to get this figured out for you, right? This is something that, you know, I am trained to do, so this is what I do. As per usual, you know, if you're new to physical activity, return to physical activity, or you have a medical condition that might make doing physical activity difficult, always discuss with your physician prior to beginning anything new. And this program is simply what I've done for myself, and just a good kind of overview example of what someone can do. So I'm not telling you to do this specifically, but this is kind of a common scenario of how to treat an injury. So that's kind of the initial preamble of kind of what I have, what I have/had, how I figured it out, so on and so forth. So now let's get into the important parts of, you know, how I went to treat it, and what I have actually done to make it better. So after I completed all of the assessments, and I was like, okay, this is what I have. I know how to treat it, because, you know, if it was other things, I would treat it very differently. So the first step for me was I wanted to, as soon as humanly possible, get moving my leg through an active range of motion as much as possible, and as far of a range of motion as possible. So what do I mean by that? Active range of motion is when you're actively engaging the muscles to move the actual limb. So active range of motion. For your hamstrings, to show you, the most direct point of a hamstring is as far up as I can bring it up to my chest. Obviously, that's the most this can get lengthened. So your hamstring crosses 2 joints. Hamstring attaches in the top of your calf and actually up in your hip. So you want to stretch it in both directions, right? So it's here, and then obviously when you straighten out your leg, that stretches the lower half of it. So that's the longest range. The shortest range of motion, obviously, is the opposite. So it's upright, and then as back as far as I can. Obviously, this is a more passive movement, but this is how you would shorten up your hamstring. But I would try to do it actively. So I'd be doing things like taking my leg, holding it, contracting it inwards, you know, laying on my back. This one actually was very difficult. At first, I could only go to about here without any pain, and then anytime above here would be painful. Just to compare, with my other leg all the way up, totally fine, no issues. This one was only about here, so comparatively much different. You know? So that's how I began working on my hamstring. For my sartorius, I just began doing active range of motion of trying to bring my foot up as high as I could and rotating it over. So those are the active range of motion. So as soon as I could, I wanted to get it moving actively in as big of a range of motion as I could, in pain-free or like low pain, just uncomfortable kind of range of motion, because we want to keep the tissues healthy and resilient and stop them from getting, you know, extra tight. Always after I did the active range of motion, I would always move into passive range of motion movements. So what is passive range of motion? Passive range of motion is where you assist actually moving the actual joint instead of actively. So actively, like I said, is engaging the muscles to move it, right? Passively would be me pulling my foot in, right? So active, my hamstring is doing it. Passively, I'm pulling it in, and my hamstring is still relaxed right now. It's still totally relaxed, but I'm going into range of motion. So what people will tend to notice is when you do passive range of motion, so when you get assisted intermovement, you can usually increase that range of motion significantly. Passive range of motion is generally much greater than active range of motion. So as soon as I would finish my active stuff where I was using the muscles, if I could only go, part of the way, I'll then begin doing the same movements, but passively assisting it to get the full range of motion, just to make sure I wasn't losing any mobility and things like that. So for a good example would be, I'd be here, and I'd actively be doing sets of 10 to 15, nice and slow within their full range of motion, which this is all I had right now, or at that time, right? Then I would come here, I would grab it, and I'd pull it in. So this is passive, right? My hamstring is not contracting right now. It is totally relaxed, but I'm passively pulling it in, right? Because if I let go, my foot automatically only goes to about there, right? So I would do my active stuff, then I'd go down, I'd grab it, I'd pull it up, and I'd do passive, just to make sure I was still getting the actual joint into its full range of motion in a relatively pain-free state. And thankfully, passively, I could always move the muscles for this injury pain-free. Active movement was my issue. So, what else did I do to help my injury? Sorry, Coach Luna. So what else was I doing? I was implementing some more contrast type therapy with a big focus, with a more of an emphasis on the icing component of it. I know in the other piece in the video, I talk about kind of the drawbacks of a ton of icing and things like that, and those are definitely a real thing. But I'm not dealing with it. This is not a standard soft tissue injury like a bicep injury or shoulder injury, so on and so forth. This is an actual solely an inflammatory issue of the bursal sacs. I want to deflame that as quick as possible. So I did use a lot of contrast work. I would use an ice pack for 10 or 15 minutes, and then I would take it off. I wouldn't use a heat pack because I didn't want to fully, heat up too much. I didn't want to make it more reactive, but I would let my body bring it back up to normal temperature, and then half an hour later, I'd throw an ice pack on it again, rinse and repeat. That's a pretty aggressive protocol, so I wouldn't really recommend that for others unless you really know your body and your health professional tells you to. But that's the protocol that I've been using for that. So yeah, there are certain times when you can definitely use, ice for those situations. That was the first about 2 weeks. That was all I was doing on the joint. I'm now, 5, 6 weeks into my recovery now. So that was the first 2 weeks, which is, actively contracting the muscles and then passively pulling them in to get them in their full range of motion, and then icing periodically throughout the day. When time permitted, obviously. I wasn't able to ice all day. Obviously, I have a job. But once I hit week 3, and things started to feel a little bit better. The first 2 weeks, there wasn't much improvement. There were slights, but not much. Once I hit week 3, obviously I continued to work on actively moving my joints further and further, as well as passively pulling them further and more intensely for longer periods, so on and so forth, just to keep it loose and healthy. As of week 3, I began to load the joint and the muscles as much as I felt safe to at the time. So what do I mean by loading them? I started to use some body weight and some external body weight to actually specifically focus on working those muscles. Specifically, they were the issue, because I want to make sure that the muscles are also staying healthy and resilient and aren't getting weak. Because if I just did nothing for months and just let this heal and did nothing with it, I'll come back fantastic. The bursitis, it'll be gone, but my leg will have atrophy, I'll have a weak leg, I'll have other issues in my leg starting to act up just because I just didn't use it properly. So I began loading it as soon as I possibly could, which for me was at about that beginning of week 3 and of week 2. So what did I do to load it? I started off with some basic, easy body weight movements. A big one for me was I have these, as Coach Luna really wants her toy and this. So this is a slider. So these things slide really easily on the ground. It's kind of hard to see, but they slide really well. They use on carpets and things like that. So what I would do is I would come here. I was laying on my back. So my foot is currently on the slider. I'll go back so you can see it. So my foot's currently on the slider, right? What I'd do is I was laying back. I would arch my hips up off the ground, and then I was straightening up my leg on it and then curling it in as much as I could. Curling, so I'm using that hamstring muscle right now, right? Curling in, and my other leg here is supporting me, so I'm not using my full body weight yet, but I was just doing this. And I would use, so this is a way I was really starting to, work on the resistance training aspect of those muscles. For my sartorius, what I was starting to do here, I would do that same movement, because it's a very unique movement that the muscle does, but what I would do is I would actually start to resist it with my hands a little bit. Just making it just a little more difficult. I even eventually tied a band to my ankle and around a chair and started to do that also. So I found that to be helpful too. So I started to load it in week 3. The only difference that changed between the loading and everything else was I changed up to my icing protocol as of week 3 too. I would not ice within about 4 hours post loading the joint and loading the muscles in the area, because icing has been shown to actually limit muscle hypertrophy, so muscle growth, if done too soon post exercise, because muscle hypertrophy training itself is inflammatory in nature to a certain extent, and if you blunt that, it does affect the actual muscle healing and muscle growth. Obviously with these movements, I'm not going to be building a ton of muscle with doing them. It's more just to keep things healthy and strong and stable and resilient, but I wanted to do whatever I could to allow the muscles to recover at their fullest. But after 4 hours, I was totally back to icing, my same protocol, everything. So that was week 3. After week 3, from pretty much weeks 4 and 5 and now into week 6, it was rinse and repeat. So every day I was slowly increasing my active range of motion movements, to which I would do a couple times a day. Follow that by a few times of, a few sets of doing more passive work where I'm pulling it in. Same thing with this movement, right? Followed by, I would do some more resistance training movements. So I eventually progressed on from my slider onto doing things like stiff-legged deadlifts, so on and so forth, which I have explained before and I'll explain in another video, but done properly, it's a very hamstring dominant, heavy movement. And then so all I did was from weeks 3 onward, I just increased the weight of my resistance training to keep it in safe ranges for those muscles. I increased the active and the passive range of motion to keep things mobile and healthy, and you just keep progressing it slowly. I only would do the resistance training movements maybe 3-4 times a week. I was doing it pretty much every other day because I do want time for the tissues to actually heal. Not that I was hitting them super hard, but I do want them a chance to heal. But I was doing my active and passive stuff and my stretching on them every single day, and icing every single day, just to help them. So, and that's what I've been doing for the last 6 weeks on this specific injury. It hasn't been a pleasant injury, that is for sure. It does affect a lot of movements, anything that involves my hamstring or bringing my foot up. But it is about 70% I'd say recovered so far overall. Which is a great thing. I know a lot of people thinking that 6 weeks in and you're not back to 100%. And that's how injuries work. They take time. They take a lot of time and a lot of effort. So it's important to realize that and to be patient and focus on you want to look more on the macro level of month to month improvements as opposed to necessarily day-to-day improvements in these scenarios. And I'm definitely much more improved than when I initially caused this injury. And moving forward, I will just continue the same protocol. Focus on active range of motion, increasing that. Focus on passive range of motion, increasing that, and continue to focus on adding external load to the joint through slightly heavier and heavier movements, workout to workout or week to week, to continue to build up the strength, the musculature, and the tissue resilience for those specific muscles that are the issue. So I guess the last thing I would say about this is often these kind of injuries happen due to certain imbalances in certain musculature in the leg, whether it's quadricep weaknesses or certain hamstring muscle weaknesses, so those, or extra tight muscles. So those are all possibilities. It could have just been a bit of a freak accident too, but it lets me know that, you know, I need to focus on trying to keep everything as balanced as possible. Not that it isn't, but just easy ways that you know, the body all works in unison and under oppositional pulling forces. So it's an important thing to focus on. So I know I need to work on continuing moving, you know, forward and things like that. And just to kind of close things off, so start off with active range of motion. I wanted to get these muscles working as soon as possible in as much of a range of motion as possible, close to pain-free as possible. If it was aggravating it a lot, I had to reduce the range of motion. So if this hurt, I would just do this, you know, whatever you can, whatever I could do. Okay? Then, once I felt comfortable, I started to load the muscles that were affected, so the sartorius and the hamstring, through some light movements, right? And I would ice it after a few hours afterwards, right? 4 hours afterwards, once I started doing that. But and then week to week, you just slowly increase, build up that resilience, build up the tolerance, keep focusing on your recovery. Another thing that I could have potentially done was look at adding in some anti-inflammatories. I personally did not implement any anti-inflammatories. I'm not a big, there's plenty of research coming out now showing how anti-inflammatories, though it helps with inflammation, does actually reduce some of the actual tissue recovery. In this scenario, I might have been able to use some anti-inflammatories, and it might have been okay because inflammation was the sole issue, so it might have been really helpful for that. But unfortunately, if I take anti-inflammatory, it really messes up my stomach instantly, no matter which ones I take. So that's out for me personally. But depending on you and what your physician says, an anti-inflammatory might be helpful for you. So I hope that was helpful. I know that was a long, fairly, somewhat sciencey video, but a really simple kind of general protocol for, for minor injuries, right, is move the joint in, as soon as you can, in as close to a pain-free range of motion as you can actively, then put it through the same range of motion passively, to make it go further. Do that every day or multiple times a day. Then you progress to adding on a bit of external load once you're comfortable doing it. It's not painful to do so. You still keep that in a safe range of motion. And then you just rinse and repeat. And you just keep progressing until you're back to normal. And with a lot of soft tissue or minor injuries, this is a great way to handle things. Nice, simple, basic protocol. So I hope you found that helpful. Please like and subscribe to the YouTube channel and the video. My name is Adrien. I'm the exercise specialist at the Leduc, Beaumont, Devon Primary Care Network. Thank you so much and have a great day.